Assalamu alaikum, everyone. As you know, I have recently moved to Chicago a few months ago. And ever since I moved, I got a lot of questions about the licensure pathways in the United States, like how to get a dental license if you are a foreign trained dentist. And I have been through that process back in 2002 when I moved to California back then. And as you know, pathways at that time were totally different than what they are nowadays. So I thought in order to give you more updated version of the latest guidelines, I have partnered with Dr. Ru'a. And Dr. Ru'a, welcome.
Thank you.
She is a newly graduate from University of Jordan, fairly new, and she also recently joined the advanced standing program in Columbia University. So she is definitely much more updated in terms of the guidelines because, as you know, guidelines keep changing in different states and with different times and after COVID. So I thought it would be better to hear it from someone who has been through it more recently. So Dr. Ru'a will take us through a lot of questions. Maybe, Doctor, you can start sharing your screen.
Thank you. Thank you for the introduction. I'm going to start sharing now and we can dive in. So, like Doctor said, I am a graduate from the University of Jordan, and I am currently a student at Columbia University, an advanced standing student. And I'm going to try my best to walk you through the different ways that you can become a licensed dentist in the US to the best of my knowledge.
Yes, so the topics we will be covering today are, first of all, the main bulk of this presentation will be about the pathways to licensure, which is, as Dr. Roa said, the advanced standing program and what it takes to be accepted, and which universities and which states accept what, and the tuition, and all you need to know about that form. And then I always also get questions about what if I do residency program in the United States? Do I still have to go through licensure? And this is a very important question. And here in that section, we will discuss that because it is different, in different states, what happens if you get a residency. And we will look into that. And then I also get questions about what if I am a foreign trained specialist already? Do I have any privilege, or do I have a way to get my dental license without, in a different pathway? So we will look into that. And finally, we will look into the immigration status and if that has any effect into the acceptance, and, what kind of visa or residency or citizenship you might need to be a student here. So Dr. Roa, take it from there.
Thank you. Okay, so I'm going to start by just a general overview. So there's three main ways that you can become a licensed dentist in the US, and I have tried to summarize them here in this slide. The first way, which is the way that I am going through, is through the CAPID application. It gets you through the advanced standing program, and eventually you graduate with either a DDS degree or a DMD degree from the university that you get accepted into. And through this pathway, as an advanced standing program graduate, you will be allowed to practice in all the states in the US. The second point that I have here is licensure through a specialty training or a residency program. That application is called the Pass Match application. And once you enroll in this program, you graduate with a 2 or 3 year-long master's degree. Or some universities also have a joint PhD program that you can get into. With this pathway, you graduate, like I said, as a specialist, but you are only allowed to practice in select states, which I'll further elaborate on in the next few slides. And the last pathway that you can also go through is through an AEGD or GPR residency program. It also is a residency program, but a lot of people choose this they refer to it as a separate kind of way to get licensed. So I included it on its own, but it's also a 1 or 2 year program that you can get into. And like the previous point, through this pathway, you are also only allowed to practice in select states. So just keep in mind that if you want to be able to practice in all states, that would be the first point, the advanced standing program, and the last 2 points will allow you to practice in only select states. Here I included an overview, which is basically the map of the United States, but color-coded into what each state accepts. So the red right here says no additional education required, and that will only be applicable to one state, which is Minnesota. So if you are a foreign-trained dentist that graduated from any other country in the world, and you come to Minnesota, after completing the board licensure for that state specifically, I heard it's a complex process, but eventually you will be able to practice in Minnesota without additional training, without an advanced standing program or residency. In the purple right here, we have a faculty license, which is if you get a faculty position in one of these purple states, you are allowed to practice as a faculty member in the training environment of that specific university. And in certain states, they will also allow you to practice, let's say, 1 day per week or 2 days per week outside of that faculty. The yellow is 1 year of GPR and AEGD, which is Virginia right here. And that is the only state that accepts a 1 year AEGD or GPR. All other states in blue accept AEGD or GPR, but they require that it's a 2-year program. And on the graphic below, you have in orange the states that will allow you to practice if you are a specialist. So if you get specialty training from any state in the US, these orange states eventually will allow you to get licensed in those specific states after completing the licensure examination of that state. And then lastly, we have in green, which is licensure by credentials. This is basically if you are licensed in any state, in any of the above pathways that I discussed now, eventually after, let's say, 5 years, it depends from one state to another, but it averages on 5 years. After 5 years of practice in a previous state, you can come to these green states, let's say California, and they will allow you to get licensure in California without additional training, without additional board examination or anything like that.
Great. Yeah, this information is very important because at my time, for example, when I was in California, there was no pathway for licensure in California except to do the 2 years in California again, you know, or at my time, again, it was licensure by examination, but this pathway is obsolete and no longer there. So I think it's becoming better for you guys, those pathways that are opening up, meaning, I mean, when I went there, I was like torn between spending time and money into repeating 2 years in the university versus doing the advanced standing versus spending those 2 or 3 years in doing residency, right? To get a specialty. It would make sense that I spend time and money getting a specialty rather than repeating what I have learned in dental school in Jordan. So, but then the issue was, what is next after the residency? If I cannot work, you know, I cannot get a license, then that is a big issue. So now the fact that these states are opening up the licensure pathway for you as a, you know, resident or a specialist to be able to get your license is really, really a good opening for you. And I think you guys are privileged that there is a pathway like this nowadays.
Yeah, like you said, it's important to be able to get the specialty training in the US, but it's also important to plan ahead and know after you get your specialty training, what options do you have? So in this graphic right here, it's exactly like the previous one. It's just written down more clearly instead of the color coding. So I just thought I would include it. And it's also important to note that the summary in this slide and the previous slide were last updated in 2020. And like Dr. Lena said in the beginning of the presentation, information is always changing, always being updated. So if you're interested in a specific state or a specific pathway, always keep in mind to check the program that you want to apply to, and the specific requirements for that state in the year that you are watching.
Exactly. And all the resources that will be shown in this presentation, I'll make a link for them at the end of the down in the description below, so that you can refer to anything that has a hyperlink in this presentation.
So yeah, I'm going to start by talking a little bit more about the advanced standing program, which is the program that I'm enrolled in right now. On average, it's a 2-year program. Some schools are a bit longer, 2.5. One of them is even 3 years long. And they matriculate you into the 3rd and 4th year of the traditional dental school pathway in the US. And at the end of the program, you graduate with the same exact degree as the traditional students. So you get either a DDS or a DMD degree, depending on the university. And what's appealing about this pathway is that after those 2 years, you will have no problem practicing in any state after completing the requirements by that state. Except it is important to note that New York, even after the advanced standing program, it is the only state that will require an additional year of training at least.
And can you tell us, like you said, you matriculate as a 3rd and 4th year. So does that mean you go immediately into seeing patients, or do you do a lot of didactics as a review? How does it compare to our 3rd and 4th years in the foreign, countries?
Yeah. So for most programs, usually before you see patients, they make sure to have a few months dedicated specifically to basically calibrating the skills of the advanced standing students. So for example, in the program that I'm in, it's 2.5 years. So I was matriculated into the spring or 2nd semester of the 2nd year. So that in this semester that I'm in right now, I'm working on mannequins. It's preclinic still, and I will not be seeing patients until June. So I've had so let's say the first 6 months of my program are for advanced standing students and traditional students, because we are joining them to just practice in preclinics and labs. Other schools that are not 2.5 years long kind of have a similar idea. So I know that UCLA, for example, it's 2 years and a few months, because those few months are meant for the students to also practice in preclinic before seeing patients. And yeah, it varies from one school to another, but that's the general idea.
I see. And do you take a lot of didactics? Like, do you go back to, courses and all of that, or is it mostly heavily clinical?
So I can speak about my program, but so far, yeah, we are taking the didactics, the preclinic, everything.
And of course, those didactics are mostly the dental ones, not like back to basics of like biology and like anatomy and things like that.
Yeah. So it's only dental courses.
Okay.
The ones you take as a student, as an advanced standing student, will be dental courses. I know some other schools may include the touch-ups on like pharmacology courses and anatomical sciences, but in the program I'm in right now, we're basically just taking any course. So if I were to refer to Jordan, it would be the courses that you would take in 3rd, 4th, and 5th year onwards.
Okay,
yeah.
Great.
Okay. And I always get asked this question, is it difficult to get accepted into the program? It is definitely competitive because so many people around the world try to apply to this program, and you're basically also in competition, not with the entire world, but also the students that are already in the US. Some people are lucky enough to get in from one cycle. Others have to go through multiple cycles to get in. I was one of the people that had to apply 2 cycles to get in. And I just included this brief point right here that after you submit your application, the general idea of how you get assessed is you are invited for an in-person or a Zoom interview. All schools will have that interview as part of their assessment. Some schools will also have a bench test, and others do not. So in the bench test, you are basically expected to prep teeth, perform cavity preparations, crown preps. Each school will differ on what they test you in the bench test. But yeah, that it's just important to keep in mind that some schools will have it.
To be honest, Dr. Ru'a, I am very new to this CAPID application, even the word and the term. So is it an application that unites, is it per school, like every school, or is it like the match, that would apply to more than one program that you're applying to be in their advanced standing?
Yeah. So for the CAPID application, yeah, I should have elaborated on this before, but for CAPID application, it's basically a centralized application for all the schools that have advanced standing programs and participate in the system.
Okay.
So I would say an estimate of 40 schools in the US have advanced standing programs. Most of them you can apply through the CAPID application. It's basically one common application for all programs. You submit a common personal statement for all the schools. Some schools will require additional essays, but it'll all be in one place. It's also important to note that there are, I would say, two schools. One of them is in Texas, San Antonio. It has an advanced standing program, but it does not participate in the CAPID application. You have to go through the website of the university itself to apply. And there is one other school that I can't think of right now, but I did include a list that includes all the schools in the last slide.
Great. And basically, while you are applying, you would tick the universities you are interested to be in, or is this gonna match you with whatever is available?
Oh, yeah. So it has all the schools that have the program, and then you can go through the list and select which ones you want to add.
Yeah, obviously, because I mean, if you are living somewhere, you don't want to move across the continent. Okay, makes sense. Great.
Thank you.
And then this is usually applied like in a certain period of time during the year, the application is open?
Yeah, so the CAPID application is normally opens in beginning of March. So that's when I recommend that everyone has all their application materials and everything ready to begin the application. And the deadlines between schools varies. So some schools, the earliest school deadlines are normally typically the end of May. Other schools have prolonged deadlines. So I know BU is in November. Some schools even follow to the February of the following year. So it's just important to be mindful of which schools you want to apply to, have that list planned out, and then make your own list of when you're expected to submit all of your applications so that you don't miss any deadline, because it does vary from one school to another.
So basically you apply in March and then you would know when that you are accepted.
So I applied, the cycle started in March. I submitted my application for Columbia, I would say in the middle of April. And then I got my interview in June. And I found out that I was accepted around August, and I started the following year.
In January or when?
In January, yeah. So some schools start in January. Most schools start in June.
Okay.
Yeah, June or July. But because I'm a 2.5-year program, so I started a little earlier than the other schools.
I got you. Yeah. And you said for that application, we need the personal statement and what else? I mean, I would assume all their, degrees from the foreign country. Do they need any other things to be uploaded? Or
yeah, so this is what you're going to need. I have a few slides that I included for.
Okay, we can come to that then if you want to. Yeah.
I'm just going to talk briefly about how to increase chances of acceptance, and then we'll dive into the details of what the CAPID application requires.
Perfect.
So I was saying about the advanced standing program. I always get asked if it's competitive, if it's easy to get in, if it's even worth going through the entire process. Because like I said, some people have to apply multiple times to get in, but I tried to summarize what I think would increase your chances of acceptance. And even if you're still a 2nd or 3rd-year dental student and you're watching this video, it's important to note the things that you can start incorporating into your student life and general life, and plan ahead so that when it comes time for you to apply and decide on your future and what you want to do and which pathway you want to take, that you already have all of that as part of your overall profile. So yeah, like I said, it's really important to plan ahead and start your application as soon as you can. Try to have everything ready and more or less finalized by March, April. Try to submit as soon as everything is ready. But it's also important to not really rush through just because you want to submit on time. Like I said, most schools that participate in the CAPIT application will require that general personal statement. So I recommend having that ready March, April, and submitting the general application for all schools around that time. But also some schools will require supplemental applications, so that you need to be mindful to leave enough time after you submit the general common application to fill out the supplementals for the schools that require them. And be also attentive of the deadlines for those schools, because the deadline includes the common application and sorry, the deadline will include the deadline for the common application and the supplemental applications. Yeah, so to strengthen your profile, these are just things I picked up on while trying to reach out to admissions committees. When I take a look at my peers and colleagues that have also gotten accepted into the programs, the first thing I always get asked about regarding profile is, what is your GPA? What was your GPA? It really is not the most important thing when you're applying to this program. And in the US in general, I feel like back home, we always judge ourselves based on how well am I doing in classes, GPA, and that's basically the make or break. But it's not the make or break for your application to US programs overall. So of course you have to get good grades and work on your application and always try to be the best, but don't stress too much if you're already a graduate and your GPA isn't as high as you would want it to be. It's also important to be an active member of your community. So I got lucky with this because I never really planned that I wanted to really have volunteer work as such a big part of my life. But thankfully, it did become that. And this was something I am certain gave me a big boost when compared to other applicants. Because like I said, you don't want to be the person that only included volunteer work right before the application process, because it'll show that you're only volunteering because you want to increase your chances. So I recommend trying to actually incorporate this into your lifestyle and actually being an active member of your community as a student and after. Research also is something I always get asked about. Did you get research? Is it important? Do you have publications? It does definitely give you a boost. I would say some schools might not even consider it, but it doesn't hurt to have it. Yeah. And the most important thing I would say played a role in my application and all of my colleagues is US clinical experience. If you can come to the US and work as a dental assistant, that is going to really, really increase your chances. Like I said, some people have to go through multiple cycles. It's okay if you end up assisting for a year or two. It's important to just be mindful of your end goal, and that this is all it's really going to prepare you for being a dental student and dental professional in the US.
Yeah, I totally agree with you, because I mean, think about it. What is better, to sit and do nothing related to dentistry for a few years until you are accepted, or to be in a dental field even if you are assistant? I mean, I know it might feel like a little hurting for your ego, or like, you know, you feel like you're downgrading yourself from being a doctor to being a dental assistant, but definitely it will keep you in the loop of the dental field, and you will learn a lot from your senior dentist, right? In terms of how he's handling his, you know, cavities or crowns or patient management. I totally agree that, you know, being in the dental field is something highly I encourage until you figure out, you know, whether you want to do this advanced standing or whether you'll be accepted in a specialty program. And on the side, you're also making some money, right? So that you can sustain a living on the side.
Yeah.
Speaking on that, speaking on the research, I totally agree. Maybe the research is not as strong needed for the advanced standing, but it will come later when we look at the acceptance into specialty programs. Here it becomes more important. So in general, it's always good idea to have some research, but like Dr. Roa said, don't stress yourself so much at this stage, you know, if you're just doing the advanced standing rather than the specialty. And in general, again, they want to see a well-rounded student, meaning someone who can have the skills to handle patients, to be, you know, an active person in the community, like you said, with volunteering. Unfortunately, in our part of the world, volunteering is not something we give value or time for. We are mostly about, you know, grades. And that makes us really good in taking theoretical examination, but I found it makes us a little bit less competitive when it comes to you know, being engaged in the community, or our social skills, or even our vision of, you know, kind of the whole system.
Yeah, and it's also important to the more things you do with your life beyond studying theoretically, the more you'll have to talk about also when it comes to interviews and personal statements. And because like you said, you want to be well-rounded. You want to have things to show, like, this is my value as a person, as a dentist, this is what I've done. And that will definitely put you on a pedestal when you're applying to any program. Yeah, so the next thing is the personal statement. Like I was just saying, it's your story. It's your time to shine and really show some confidence. I wouldn't say be cocky and you know, overly confident, but if you don't believe in yourself, you can't expect admissions committees to. So you want in your personal statement to show them as someone that knows your own value, that sees your value and your worth, and will be willing to also use that to contribute to programs in the US and to the dental field in the US. So that's a nice kind of message to send out in your personal statement.
Yeah, speaking of the personal statement, sorry, Dr. Ru'a, to interrupt.
No, it's okay, sorry.
Yeah. Remember that that person who is getting the applications, and I have been sitting on interview committees. You know, as you know, I am a faculty of ortho. I've been in Dubai for many years, and I have been engaged in interviewing ortho residency applicants. So for us, when we are looking at personal statement, basically, I don't know this person. This person is just some a file of paperwork, right? Apart from the picture, I have no clue what is this person is all about, right? So I'm looking at their GPA, I'm looking at their, you know, diplomas, blah, blah, blah. But then I don't have any sense of touch with them before, of course, we do the Zoom interview or the in-person, except that personal statement. So take this opportunity to actually communicate who you are in the essence, you know, to introduce yourself, introduce why you are interested in this dental field or that specialty, and what experiences has led you to be, you know, where you are now, and how you kind of learn from them. Many times people, you know, express the hardships they have been through and how it makes them stronger and where they are now and how they vision themselves to be a really good member of the dental community in the future. So something like that. So give your personal, true, authentic self through that personal statement, I would say.
Yeah, that's very, very good points. There is just one thing, like you were saying, you see them as like paperwork because you see the CV, you see the experiences section. In Capit, it's not like a CV per se. Some schools will allow you to upload a CV, but they have an entire section where they can see your experiences, which is basically like your CV. This is something I forgot to mention. When you're writing your personal statement, they already know your paperwork. They know what you've done in terms of where you've worked, where you graduated from. You want to, like you said, show your essence as a person, more than just listing out your CV over and over again, because they already have that side of you.
Exactly. True.
Yeah. So for the next point, I'm going to touch up on strong letters of recommendation. Before, I would have just said letters of recommendation, but then someone mentioned to me, it's not enough to just get a letter of recommendation. You want a strong letter of recommendation. You want to ask for the letter from someone that can, in Arabic we say بيشهد على, like, your value as a student. So you want someone to basically confirm.
Testify that
Yeah,
you are
testify.
really worth it.
Yeah, that's the word. Sorry. Yeah.
Yes.
Yeah. So you want someone to attest to your strengths. You want them to highlight it, because it's nice to do it on your own in your personal statement, but we can all talk about ourselves. It's also important for the university that you're applying to see that while, yes, you said those things about yourself in your personal statement, you've mentioned all these things in your CV, but when you get your own mentors and people that have taught you also testifying to that adds so much value than asking for a letter of recommendation from someone that barely knows you, or that will give in a letter of recommendation that's like simply a template. I remember for me, when I was asking for my letters, I asked to meet with my professors and the people that I was working with at the time in the US, just have like a one-on-one conversation with them for you to talk about yourself, and for them to basically give you an idea of how they know you, and if they have any questions that they would like to ask you. So I feel like this is something, maybe Dr. Lana, you can add more to that, but this is something I feel is not highlighted enough, because so many people just ask for letters of recommendations and they end up getting templates from professors that send out the same letter for everyone.
True.
But when you're a strong candidate, you want someone to testify to the, key points and like just things that, I don't know, would interest a committee when they're reviewing you.
Yes, they want to see what is unique about you, like what was unique. Again, we go back to this well-rounded applicant. So here the well-rounded will come from a 360 view by adding what the faculty think about you rather than what you are only saying about yourself from a personal statement, right? So this will make you kind of get a view about you from all aspects. And that's why it takes us to that in real, you should have been impressing your faculty when you were in dental school and your foreign trained, to begin with, so that it doesn't become like you're soliciting, fake kind of, recommendation letters, but you didn't really do much or you didn't impress anybody. So that again, take us, if you are a student still in dental school, make sure you shine in your group and you do extra stuff to be actually someone who deserve a very unique recommendation letter when the time comes.
Yeah. Thank you, Doctor. So the next point I will just briefly touch up on is, like I said, there are many schools that have this program. It's important to make a list of the programs that you are interested in, but also I would recommend trying to maximize the number of programs that you apply to. For me, something that made a difference between the first and second cycle was in the second cycle, I applied to more than half the number of schools that I applied to in the first cycle. In my first cycle, I got only 1 interview. In my second cycle, I got 6. So I would really, really, really recommend to... I know that I probably had some things that added in value to my application in my second cycle, because I did try to work on myself during that year. But you really don't know what school looks for what in which applicant. Some schools will look at your profile and be wowed in a second. Other schools will not really be impressed with you, and that's okay. That's why I'm saying when you maximize it, you will maximize the amount of schools that want you as someone in their program.
Very good point.
All right, so now to continue on to the requirements or prerequisites for your application to the advanced standing program. And these are going to be things that you will have to upload to your CAPIT application. So the first thing I'm going to talk about is the IMBDE. It used to be a 2-part examination, part 1 and part 2, and that's the one that I sat for. After 2020, they discontinued that, and now it's just one part. It's called the Integrated National Board. So it's the IMBDE. So now you're tested all of that information into one test. It's 2 days. The first day is going to test just didactic or theoretical standalone questions. And it more or less tests still the same information that was tested on the 2 separate boards. So you get tested on anatomical sciences, dental anatomy, a little bit about biochemistry, physiology. I know that now in the IMBDE, students have been saying that there is less focus on the medical kind of subjects and more focus on things that are relevant to dentistry. Day 2 is going to be case-based scenarios. So you get a case, and following that, you get several questions on that case. And I have specifically how long the exam is. Day 1 is 8 hours. Day 2 is 4 hours. And of course, you get breaks in between. The second point I have here is that it's really, really, really important to check the IMBDE guide that is posted on the JCNDE website. It will have step-by-step, a step-by-step process of what you have to do to sign up for the exam. Because I won't lie, I remember when I was applying for the exam, it is kind of it's a multi-step process, so you can kind of miss things out. I try to include everything here, but always check the most up-to-date guide that's available. And when you're checking the guide, you always want to check, since we're foreign trained dentists, we have attended non-CODA accredited, and that just means non-US or Canadian dental schools. The first thing you're going to want to do is you want to create an ECE account, and ECE is short for Educational Credential Evaluation. So basically, you're sending in your transcripts to the ECE, and they will evaluate it in a way that will give you transcripts as if you were in the US, and you get new grades, new GPA, and that's all calculated. And when you create your ECE account and you submit, you want to make sure to select that the ECE sends your evaluation to the JCNDE, which are the people or the association that is in charge of the NBDE exam. So for the ECE, like I said, you will have to mail your transcripts to them. In the guide, there is an exact mention of where you want to mail your transcripts. You want to make sure you select that they send it to the JCNDE, and then you can put the ECE thing aside. In the meantime, create a dent pin on the ADA website, and you want to submit or apply for the application to sit for the IMBDE exam. Once you're done with that, there will be one last thing you're going to have to do. And a lot of the time this can be missed because it's only briefly mentioned on the guide. It's called the certification of eligibility. So the certification of eligibility is basically just a document that you will give to your dean or someone in your faculty, and they will stamp it and just basically testify that you've taken all the courses that are required or tested for the NBDE exam. And you want to also mail that to the address that's mentioned in the guide. Once the JCNDE receives all of these, once they get your ECE, once your dent pin is made and you've submitted the application, and once they receive the certification of eligibility form, you will receive an email that will allow you to sign up for the test. And once you get that email, you have, I think, 6 months to schedule your test. And like I said, you will get emails throughout to kind of guide you through the process, and definitely your go-to should be the NBDE guide. Now, when is a good time to prepare and take the test? So when I did it, like I said, it was part 1 and part 2. I'm kind of a nerd, so I started preparing in the 4th year of my dental school. So we had a long break between 4th and 5th year. It was 4 months long. So I spent, I remember, around 2 months prepping for part 1 of the exam, which is basically mostly the things that are non-dental, in addition to dental anatomy. So I studied for that over the course of 2 months, and I started preparing, like I said, in 4th year, or when you start really diving into more of your clinical years in dental school in foreign trained schools. Now, since it's the IMBDE, I would suggest also preparing for it side by side when you're enrolled in your foreign school or foreign training. So there are resources right here that I linked, and something that I will mention is Mental Dental. It's a YouTube channel with free explanations for everything that's tested on the board exam. This guy kind of saved my life when it came to board preparation. His name is Dr. Ryan. He was also a dental student, and he made everything accessible. And honestly, I have him to thank for the revision process that I did for the exam, because now that it's also in one exam, it's a lot of information that you're going to be tested on all at once. And it's going to be months of preparation. And you don't really want to get to that end point mark where your test is in a few days and you've forgotten a lot of what you've studied over the course of a few months. So the reason I say is try to prep for it throughout your dental school is because these videos, the longest videos you'll find are like 20-30 minutes, and those are like only a small portion of them. A lot of them you can watch on a regular basis while you're getting your foreign education. So I feel like that's something I would probably incorporate into my studying. Personally, I studied through Dental Decks, which are basically flashcards that are available online. You can also find them. In Jordan, I would say there's a library called ABC Bookstore that you can go to, and you will find booklets of these flashcards available to you. I want to mention that they are very, very detailed compared to what's actually on the test. So Dental Decks goes into a lot of depth for every topic. So I think it can be overwhelming when you're preparing through Dental Decks, because by the time you're done preparing, like 6 months down the line, let's say, if that's the amount of time you have, so many things you would have already forgotten. So I would say choose something that doesn't go deep but goes wide when you're studying. So you want to touch up on all the topics, but not to spend too much time diving deep into the topics, because the board exam, they want you to pass the boards, basically. And one last thing I want to mention about the resources is Dental Bootcamp is a resource I haven't used, but I've asked my colleagues here in the US, and they prepare through Dental Bootcamp, and it's a collaboration between Mental Dental and a website that kind of constructed questions that are similar to the ones that are on the board exam. So it's just nice to have alongside your Mental Dental videos. You have questions that you can practice throughout.
Very nice. You reminded me of when I took my part 1 and 2 was back 2001. And again, I was also a fourth-year dental student.
Yeah.
Yes. And actually, it is good to be done at that time because you are still very fresh on the theory of the basic theory. Like you said, the medical ones that they were, biochemistry and all of this stuff.
Yeah.
But at our time, it was not pass and fail. It was more like with grades. So I noticed that you said here it's only pass and fail, and they don't really care what grades you get. At our time, it was competitive what you get as a grade. It adds more value to your application at the time.
Yeah, I think in the guide, it says they will only show you your score if you failed. So the passing is now 75. So if you get 74 or below, they will show you a score. But if you pass, then you only see pass.
Okay, nice. I think they're trying to making it easier, I feel, all over.
I think it removes a lot of the stress when you're preparing for the exam.
Right. Yeah. Because for us, it was difficult. I only had Dental Decks. I didn't have any YouTube at the time, of course, and nothing. And I remember, from that library in Jordan where you copy them, and it's overwhelming.
Yeah, so that's it on the IMBDE. Another thing you're gonna need is the TOEFL, and yes, you will need it no matter what passport you have, and no matter what country you graduated from, and no matter the language that was used in your school. So even if you learned in English, even if you have a US passport, you will still have to do the TOEFL because you are still considered an internationally or foreign trained dentist. Just a resource worth mentioning that helped me. Also, sorry, doctor, but this is another YouTube channel that helped me prepare prepare. It's called TST Prep. It is a very, very valuable resource when applying for the TOEFL. Honestly, I didn't really have much time to prepare for it. So this was really nice because it was concise, it was condensed. He gets to the point of what you have to know for the test, and even has templates that can help you guide yourself when you're trying to prepare for the writing and speaking sections. Like you can just have those templates, kind of a general overview of what you want to say, so that in the test you're not overwhelmed with all the different ways that you can give your answer. And schools here prefer that you have, some schools actually have it as like a filter. If you get below 100 out of 120, you're not considered. So I would say aim for greater than 100 out of 120 on your TOEFL score. And another thing I want to mention is that in COVID, the option to take the at-home TOEFL test became available, but that is not accepted by all schools. Doctors, like, they have it so easy compared to me.
Come on, we used to go to the, I don't know, to the embassy or whatever testing center. It was very strict.
Yeah, and I did mine in the Mid-East, I think.
MD, صح.
Yeah, so but a lot of people do the at-home edition, and it's, I would say I wouldn't recommend it because a lot of schools on their website say no, we do not accept the at-home TOEFL.
Come on, how can they control the cheating and like
Yeah.
make it fair and the writing and all of that? Yeah. I
Well,
think usually the hardest part of the TOEFL is the writing part. Usually we don't score very well on the writing. And I think that's why they insist that we take the TOEFL, because they want to make sure that the people who are coming are able to write properly. Because it's different when you are able to speak and understand versus comprehension and or writing. And this is, I think, usually also what we are missing on, which is the part where they run someone speaking and you just have to pick up on the answers, I believe. So because again, when I look at it, again, when I am dealing with my students, it's very difficult to deal with a student who cannot write proper English. Whether in the exams, when I'm examining them and I'm reading their handwriting that is like messy and like the words do not make sense with each other, or whether when they are writing their thesis, when they have to write a lot, it becomes really, really difficult to deal with these students. So I think this gives us just a basic level of you have to improve your basic reading and writing skills in English so that you can be able to manage the load of writing and reading that you have to do during dental school. So it makes sense that they have to filter us through these routes.
Yeah, and it's also important because you're going to be dealing with patients as well. So they want to make sure that you're capable of, taking a proper history, conversing with your peers and your professors and your patients.
And writing the notes, because, in the US, writing notes is a very legal document, right? And it's a liability. So you need to be able to write proper English and, not just messy English that doesn't count.
Yeah, of course. So that's it on the TOEFL. The last thing I want to mention about the advanced standing program, the reason I went into depth is because this is the program I'm in and I'm most well versed in. But this is just an overview of the wide range of tuitions that you will be paying as an advanced standing student. It is variable, number one. So you can see it ranges from 120K. This is the overall tuition that you're going to be paying for the entire program, not per year or per semester. So in this university right here, Puerto Rico University, or even University of Michigan, it's 100-something K. And then your most expensive, sadly, is the one that I'm in right now, Columbia University. But yeah, so it's a wide range of money that you're either going to get student loans on. If you're a green card holder or a US citizen, you will be eligible for student loans, so you can definitely apply for financial aid and relieve yourself of that burden for a while at least. Sadly, international students, foreign trained dentists are not eligible in most schools, at least the ones that I've looked into. You're not eligible for scholarships. So that was something that I wish there was another way around. But yeah, that's basically it on tuition. Also, it is changing as everything else we mentioned in this presentation, it changes from year to year. So for Columbia University, for sure, I think the tuition right now is 480, more towards 500K.
Wow.
So yeah.
Oh, that's a lot. That's a
That's
lot.
a lot of money.
That's a lot of money.
Yeah.
Yeah. Yeah. I'm glad I did it back in the days when things were more affordable.
Yeah, it was definitely you definitely have more affordable options. Each school is different. But yeah, I chose Columbia. So
Yeah.
I'm
I think
here.
I was lucky because I spent the money for the specialty of ortho rather than repeating the 2 years.
Oh yeah.
As I said, at my time, I was the last batch who can get licensure through sitting for bench exam and the part 4, which was on the patients, and that's it. And that was kind of the end of this route in California back in 2005, 6 time, So I'm glad I didn't have to go through any of this, and I spent the money only for my specialty. And yeah, but you guys really, God help you with all these student loans. I mean, people would graduate with like $500,000 student loan, and on top of that, living expenses and stuff. Oh my God, that's a lot.
Yeah, it's a lot, definitely. But hopefully it'll all be worth it.
It will, because here I noticed that dentists are well paid in the United States. When you graduate, it's different than our countries. And unfortunately, as you know, I recently moved from Dubai, and we have an oversaturated number of dentists in the Arab world, whether in Dubai, whether in Jordan, all of that part is overly saturated. So newly graduate general dentists, unfortunately, they are not able to find jobs, or if they find jobs, they are paid very, very minimum. Like in Dubai, a dental assistant is paid better than a newly hired general dentist. Imagine. So it's really sad that it has reached to this situation, because we are accepting too many students in dental schools in the Arab world. We're graduating hundreds every year, if like really hundreds. And I don't think the market is able to absorb that much newly graduate. But here in the US, I find that it's open. It's a full continent. I mean, no matter how competitive it can be, you can spread out to more rural areas. You can, move around. So hopefully you are able to pay your loans, I mean, soon, by generating this amount of money. And I know I had many colleagues who have been through this route that I worked with. So they did the advanced standing first and then the specialty. So they ended up with like $1 million worth of loans, and they're still paying it till now. I mean, and like they're really old, like in our 40s and 50s, and they're still paying their loans. So imagine. So God help you guys. But what other route we have? I mean, you don't have a lot of other options.
Yeah. No, but I will say I've heard mixed opinions. So I was working with I don't know if you still want to include this in the video, but I was working with oral maxillofacial surgeon that graduated from Harvard. She did undergrad in engineering, and then she applied to dental school. She graduated from dental school, wanted to go into surgery, so she also had to go into medical school. And then through the 4-year residency after you get the 2-year of medicine. And she was in a lot of debt, but she told me that after I got to that point where I was a full oral and maxillofacial surgeon, I had so many loans that I was worried about paying back. But she's like, I paid them back in 2 years.
Oh, that's
I don't know. Maybe she's a one case or special scenario, and she got lucky. But just it's what helps me get through it. And inshallah, at the end of this, I'm at a point where inshallah, like I'll be able to pay it back without having to worry about that much.
No, don't worry. I mean, as long as you are able to work as a dentist, it will come. Yeah, I think the people who would drag it a lot are the people who started families and they ended up with a lot of kids, or they invested on the side to buy a house. And I mean, they chose to spread it out so that, they can do still other things. But if you just want to focus on paying that loan and cut back on expenses and things, I think is doable.
Yeah, I hope so.
Great. So I think this concludes our first part of this presentation, which mainly talked about the advanced standing programs. And then we're going to continue in part 2, the other pathways, which are through residency and AEGD and et cetera, et cetera. So we'll see you in part 2.